Hi, my name is Fedleen, and my research article focused on the treatment of iron deficiency and iron deficiency anemia in pregnant women using intravenous ferric carboxymaltose. So, the purpose of this study was to evaluate the effectiveness and safeness of administering ferric carboxymaltose to pregnant women with varying forms of iron deficiency anemia and iron deficiency with no anemia. The different groups that they, or the, yeah, I guess different groups that they categorized the women into were iron deficiency with no anemia, iron deficiency with mild anemia, iron deficiency with moderate anemia, and iron deficiency with severe anemia. And for those who may not know, ferric carboxymaltose is an iron carbohydrate complex used to treat iron deficiency in adults who have kind of developed a resistance to oral iron supplements or who have had an unsatisfactory response to oral iron supplements. So iron deficiency anemia and iron deficiency non-anemia are both health issues that affect over 30% of women around the world. They cause unfavorable health effects not only for the mother but also for the child. In the mother, you may see things such as cardiovascular problems, reduced immune functions, increased depressive episodes, as well as peripartum hemorrhage. And that's essentially bleeding around the time of birth. So it can be a few weeks before the birth or a few weeks after. But essentially, the blood loss leads to an increased chance of mortality for the mother. And in the child, you may see a preterm birth, fetal growth restrictions. There is a possibility of a stillbirth and a low APGAR score. Now, the APGAR score is usually administered immediately after the birth of the child to determine whether extra or emergency medical attention will be needed. Usually, the lower the score, the more likely it is that an emergency medical care will be needed for the child. Now, this study is only among 6 others that have kind of focused on this topic. And I think it's important to, have these kinds of studies so that clinicians will know whether or not this is a safe option for pregnant women. Um, Now, this study had a sample size of 863 women, and of the 6 kind of studies that have focused on this topic, this one is the largest. And the supplement was intravenous ferric carboxymaltose. Um, and it's essentially like an alternative to oral iron supplements. And the way they determined how much each woman would get was based on their body weight. So for every 20 milligrams of ferric carboxymaltose, um, or for every kilogram of body weight, 20 milligrams of ferric carboxymaltose was administered. Um, in order to determine the effectiveness of the supplement, they did blood samples 3 times. They did one pre-infusion and 2 at post-infusion visits, one at 3 weeks and the last at 6 weeks. Um, they also did a hemoglobin analysis using sodium lauryl sulfate, and they looked at hemoglobin because it contains 70% of our body's iron. And they also did a ferritin analysis, and ferritin is a blood protein that also contains iron, so it makes sense that they looked at these 2 concentrations to determine the effectiveness of the supplement. And lastly, they also observed the women for a period of 60 minutes before they were allowed to be discharged, just to make sure that, everything was okay and that they were allowed to go home. Now on to the results of the study. According to this graph here, the hemoglobin levels at the first post-infusion time, which was at 3 weeks, the levels of hemoglobin here were significantly higher than the pre-infusion levels, and that is for all of the groups. And the dotted line represents the adequate amount of hemoglobin in or for adults. And at the 3-week post-infusion time, only the iron deficiency non-anemic and iron deficiency mild anemic group were above that threshold. At 6 weeks post-infusion, the iron deficiency non-anemic and iron deficiency severe anemic groups did not see a significant increase in their hemoglobin concentrations, but in contrast, the mild anemic and moderate anemic groups saw a significant increase in their hemoglobin concentrations. And lastly, at 6 weeks, all groups excluding the severe anemic group had reached or surpassed the thresholds for adequate amounts of hemoglobin. On to ferritin. At the 3-week post-infusion time, the levels of ferritin were significantly higher than the pre-infusion levels, and at the 6-week mark, the ferritin levels had remained elevated. Now, for the postpartum part, they were not able to administer tests to all of the women who participated, but only a subset of women who participated. And either way, it showed that the levels of ferritin had significantly decreased postpartum. Onto the discussion. Intravenous ferric carboxymaltose essentially demonstrated its effectiveness in restoring hemoglobin levels 6 weeks post-infusion. There was also no hemoconcentration that occurred in iron deficient women without anemia, and only 11% of the participants experienced adverse effects, and even then it was moderate. It was something such as skin irritation at the site of injection. There was no adverse effects observed for the child, and treating all forms of iron deficiency actually led to improved health in newborns. One thing that they saw was that the birth weight of newborns was comparable to population norms. And I also think it's important to mention that identifying and treating iron deficiency and iron deficiency anemia is very important because some of the symptoms associated with low concentrations of iron are fatigue and irritability, and these are things that can affect how well a mother can care for her newborn child. So if we were able to kind of treat this and get a proper plan of care in place, it would just make for a healthier baby and a healthier mother. To conclude, intravenous ferric carboxymaltose was able to effectively and safely restore hemoglobin stores in pregnant women with varying degrees of iron deficiency anemia. And this slide here is just some of the sources that I used to get my information, and that also helped me to define some concepts that were unfamiliar to me. Thank you.